Hi, my name is Amber and I am one of the nurses here with Dr. Robert Kratschmer, board certified plastic surgeon. Today I'm going to tell you about our post-op instructions for our surgery patients when they come in and do liposuction or if they do Smartlipo. When the patients come in, I usually begin by just telling them a little bit about what to expect from the procedure. The procedure is sometimes done under a local anesthetic, meaning you're awake and the area is numb, or sometimes the patients want to be completely asleep under general anesthesia. There are benefits to both. I won't get into all of that, but if you do it awake, you can generally, drive yourself. You don't have to worry about being too sleepy or out of it the rest of the day. If you are sensitive, then, if you don't like things done to you, if you react, if you find things painful, where you feel like some other people don't, then that may be something that you might want to be put to sleep for. If you are doing a fat transfer, we do put you to sleep because we can numb you for the lipo part of it, but we can't numb you for the fat transfer part of it. So any way you go about it, however you're doing this liposuction, whether you're doing the Smartlipo with the laser, whether you're doing the regular one, whether you're awake, whether you're asleep, whether you're transferring the fat, whatever you're doing, the actual post-op recovery is the same. So for liposuction, because he is going in and this is your skin, this is the fat layer here. This is a subcutaneous fat. You have muscle and organs, and you have another fat layer here surrounding the organs, which is like your visceral fat. We can't liposuction visceral fat. So if you've ever been told that your fat is visceral, you were probably told that you were not a candidate for liposuction because we can't get to that. We would poke an organ, you just wouldn't do that. So we're only taking this, it's right here above the muscle, and that's it. So he goes in, he's gonna inject some tumescent solution, which is saline, lidocaine, and epinephrine. The lidocaine numbs you for the procedure. The epinephrine shrinks down the blood vessels. So you may notice that when somebody does like a tummy tuck or something like that, if you've ever watched them do a surgery, they're taking their electrode, their cautery, and as they are, going through the skin, you have blood vessels that are bleeding. And so they'll stop and they'll go, and they'll, cauterize those blood vessels to stop the bleeding. Well, then you're thinking, well, how the heck do they stop the bleeding when you're about to go in there with a dull cannula and hit all my blood vessels? Well, that's what the epinephrine's for. So the epinephrine shrinks down the blood vessels in that area so that we won't cause bleeding when we're actually going through with the cannula. The other thing is the cannula is not a sharp cutting tool. It is dull and it has holes in it and it's just made for suction. So you're very sore, very, very sore after regular liposuction because they're going in with that cannula and they're taking this fat that's the consistency of like Jell-O. So think about trying to suck Jell-O through a straw. Like you're gonna have to break it up into small pieces to get everything out. And it's very traumatic on the body. Think about everything you're hitting. You're hitting all those, you're hitting everything and it's sore. You feel like you were, it feels like trauma. It feels like something hit you. And you're very sore for the first couple days after that. So that's it basically. So he goes in, he makes a tiny little incision, it's about the size of a staple, and he goes in and he suctions that out. Smartlipo, on the other hand, and we have the Smartlipo triplex, which is the newest version. It is laser liposuction, so it's liposuction plus laser. What that does is, so the process is the same as far as we put all the tumescent solution in there to numb you up, and we make the little incision, but we go in with a laser. Just use a different pen. So we go in with a laser first, and we're going right under the surface of the skin, and we're causing these micro traumas. So we're injuring the underside of the skin on purpose. And then we're gonna go in and we're gonna melt that fat layer down. So we're gonna melt it from a jello to think about like an oil. So we're gonna do that. Then we're gonna go in with our suction cannula and we're gonna suck out oil. So when he is using that cannula, instead of being like having to really break up those pieces of fat, it glides. It's like, I mean, it just glides in and out while it's suctioning. So not only are we getting a more efficient fat removal because we just melted it down to an oil before we took it out, so we're able to just really get a smoother, more, just overall just better result. It's also less traumatic because we didn't just beat you up trying to get it out of there. So the recovery, honestly, and I can say this because I've done both, you can't even compare it. It's, to me, I felt like Smartlipo was less than half of the pain from regular tumescent liposuction. You still have swelling, you're still gonna swell up, so the recovery aspect after that point as far as swelling is the same, but it really saves you those first like 2 days of trauma from that. So we do all that. We have these little tiny incisions. We usually leave them open. Sometimes he stitches them closed, but we usually leave them open. That way all that extra fluid can, you know, kind of soak out that first day. Because we just made all those holes in your tissues, your body's response is to fill things with fluid. So it's going to start trying to fill those little holes with fluid. That is why we put you in a compression garment immediately. And that is why you wear your compression garment 24/7 for the first few weeks to try and keep your body from holding on to that fluid. I usually tell patients like, hey, that first day, because it's from the time you leave until, you know, through that evening, when those little incisions are open, it's so messy. It's like you want to go home and put towels and things on your bed because you're numb. You can't feel that you are making an absolute mess. You can't feel that your clothes are wet. So you want to go and make sure that you've got some waterproof stuff in your car for the way home, down in your bed and all that kind of stuff so you don't ruin your sheets. And then it takes about a day or so for that to close. So you may wonder, well, why don't we just stitch it closed so it won't make such a big mess? We leave it open to help you get rid of some of that fluid, because if we were to stitch it closed, you would be even more swollen. So, and you know, your body's lymphatic system will absorb that, you'll pee some of it out, and then some will drain from the incision. So I usually tell people, I'm like, hey, while you're numb, as soon as you get out of here, while you're still numb and not feeling anything, I would go home and I would just say I did my arms. I would try and just kind of massage a little bit. You don't want to be touching the incision because it is tiny and it's not deep, but it is still an open area of the skin. So don't handle it, don't touch it, but you can kind of massage the area and try and get some of that fluid out the first day. Once it closes, don't reopen it. Once it closes, it's closed. The chance of an infection from liposuction is I don't think I've ever seen it. In 12 years, I don't think I've ever seen it, because your incision, it's open, it's tiny, and it's being flushed with that tumescent solution until it closes. So what's the tumescent solution? It's saline, it's lidocaine, which is a natural antiseptic. So it's being flushed with clean stuff until it closes. So the chance of getting an infection is so small. We actually, for just lipo and Smartlipo, we don't even prescribe post-surgical antibiotics. We will if you're doing a fat transfer or if you're doing another procedure along with the lipo, but just the lipo, we don't. The chance of having any type of infection is so small. Now, the way you can get an infection would be if you soaked in water. So once you have this surgery done, even though those are small, You cannot soak in any type of water until they're healed. The scab is gone. You can shower 24 hours after you stop draining fluid. Once you stop draining fluid, that tells us that the incisions are closed. And then you can start shower, but no soaking in any water. And do not even think about going to any type of freshwater, beach, lake, anything like that until your incisions are completely closed. And that would be a few weeks. And you probably want to come to your month appointment and make sure of that first. So the garments, we send you home in a garment and you are going to wear that garment again 24/7. I recommend getting a big thing of just like maxi pads because they're so absorbent and they're sticky and they stay on the inside of your garments. Get the really thick ones and then you can just kind of shove them down in there and cover those little holes to keep them from leaking the first day. And once you're done with that leaking, then you don't have to cover them anymore, but you are going to stay with the garment. Now you're just swollen like crazy the first few weeks. You're just swollen. We're not looking for any kind of shape. We're not looking for a result. I don't want you to call me and be like, oh, I don't notice a difference. Well, you're not. You're not going to notice a difference because you're so swollen. We got to get rid of this fluid. So it takes a good 3 to 4 months for that swelling to go away. For the first month, you're just compressing to just try and make a difference. After like 3 weeks to a month, then you can start trying to find a faja or find a garment that you like the way it makes you look. You like the shape it's putting you in. If you're wearing a garment and you don't like the way it makes you look, do not wear the garment. Or you can take Lipo foam, which Lipo foam is available on Amazon and some other places. And it's basically like sheets of soft foam that you can put in. So say you have a garment, which happens actually a lot with the binders. So say you're wearing a garment on your waist and you notice that when you sit down, the garment bends. So it bends into a point into your sides. So when you take that garment off, you have this weird shelf thing on your sides. Okay, so what you can do about that is, number one, you can change your garment to something that's not quite so stiff and bendy. Or you could also take the Lipo foam, which is basically like a piece of fabric, and you can take it and you can put it inside your garment to try and smooth that off. So you can use Lipo foam for extra compression also. So if you notice that you've got your waist done, but it's making you kind of poochy or something like that, you can take some extra Lipo foam and put it where you want the extra compression to try and even that out. So Lipo foam is a really, really good way to just kind of help fit your garments a little bit better into the shapes that you want. Get a lot of questions about supplements and things like that. You know, your body's going to take 3 to 4 months to get rid of the fluid. You can do massages. Do not let a massage therapist reopen your incisions though. You will get an infection. But you can massage, you know, I've actually had people get infections or I've seen, not on lipo, but other procedures trying to get massages, and it's a lot of like touching and putting bacteria into those incisions, and I just don't really recommend it. There's no reason for it. You're going to get rid of the fluid. You can do it with garments without massages. If you really just feel like you just have to have massages, at least let your incisions close first. There are supplements like this one we carry. This is Silogen's product, but this is bromelain that can help with the swelling. And that's okay. Arnica too. I think Arnica's okay for, I think it's great for small areas on the face and things like that. But you see this tiny little tube of Arnica, it's going to be hard to use this for bruising. I really like the pills. I think when you're doing it on the body and you're trying to, you know, reduce bruising, the pills are better. Arnica doesn't store in your system, so if you don't see a bruise, then there's no reason to take it. The bromelain does, it helps with swelling. If you're going to choose something, if you just really feel like you have to take something for swelling, then do this. Because other things like anti-inflammatories, Motrin, it's fine. It's fine if you're doing regular lipo, but when you get into Smartlipo, where we've come in and we've purposely caused this micro trauma into your skin, the reason that we did that was so that your skin's like, oh my gosh, what happened? I'm injured, let me heal. And so it will start trying to heal the skin, and when it does, it can give us basically that skin tightening and collagen production. So it helps give your skin a boost. But what it's doing is it's reacting to the trauma. So if we start taking Motrin and anti-inflammatories and things like that, it can calm down. They don't, I mean, it's still science they don't know a whole lot about, but they think that taking anti-inflammatories can calm down that tissue response. And so we don't want to minimize the effect that we're trying to achieve from the skin tightening, if that makes sense. Your meals are not restricted, your activities are not restricted. You can go work out, you can walk, you can lift, you can do whatever, because we're not cutting and cauterizing blood vessels. When we're restricting your activities, it's because we don't want your blood pressure to pop open those vessels that we just cauterized. But remember, with liposuction, we didn't cut through any vessels. We shrunk them down, moved around them. And so it's okay. They're not injured. They're not, you know, after, you're going to rest like, a couple of days, obviously. But we're not restricting your lifting and things like that the way that we do with when we actually have an incision. Your biggest restriction is just the fact that you can't soak in water. So no bathtubs, no hot tubs, no going to the beach, no going to Schlitterbahn, none of that stuff. You can shower and dry off. That's what you got to do. I think that's the biggest thing, the biggest questions that we have about the lipo and the Smartlipo are the fajas, the garments, just in general, everybody has questions about. And then, what's the difference? People ask all the time, well, what's the difference between Smartlipo and regular lipo? And the biggest difference is just the Smartlipo, which is better. I mean, I love it. I love it. I love it. It's easier recovery, removes more, tightens the skin. However, if you're trying to transfer the fat, then you can't use Smartlipo because Smartlipo breaks down the fat. And when we transfer it, we're trying to keep the fat alive. So if you're doing a fat transfer, then you will have to do regular tumescent lipo. And that's another thing. I'll just cover the fat transfer real fast since it's always part of a liposuction procedure. So if you are not having a fat transfer, if all you're doing is removing the fat, then you can almost turn this video off. Let me just tell you about chin lipo real fast, and then you can turn the video off. So chin lipo, same process. We put you in the garment, everything's the same. You have one little incision right here. We fill you up with fluid, we suck out the fat. If you have Smartlipo, we tighten the skin. You wear the garment, 24/7 for the first couple days. The face just gets rid of swelling better. Then after that, you're gonna wear the garment from the time you get home from work to the time you leave for work again. The more you wear it, the better. And sleeping in it and things like that. The only thing that I want to point out about chin lipo is that we have another option. We call it the last lift. It's a precision treatment. It's a different laser. It just has more of a skin tightening effect. The laser is stronger. So if we quoted that for you, that's why, because we just get a way, way better skin tightening with it. It's called the precision treatment. It's by Cynosure. It's also the same one that we use on the body for cellulase. When you do chin lipo, you don't have the option of being asleep for it, and the reason for that is because when you're awake, it's such a fast procedure. It's like 20 minutes in the OR. He comes in and he does all that, but he needs to be able to get right here to make you happy, to give you a better result. And if you are asleep when you do it and you've got that tube in your mouth is being held open. And so he can't get as much definition on the jawline if you're trying to do it asleep. So if you're coming in, if you're doing all these areas and you want to do chin lipo, then just know that that's going to be on a separate day. You can drive yourself to and from. That's a, you know, about an hour-long thing and you're done. Okay, so if all you're doing is lipo and that is it, you can turn the video off because I'm going to talk a minute about the fat transfer. So the fat transfer, we once we suck out the fat with tumescent liposuction, we only have 2 hours that fat lives for 2 hours. So it's a fast procedure from there to get it back re-injected. 2 hours is plenty of time though. I mean, that's actually kind of a long time. So we have to keep it on ice, keep it cold, and because we're trying to keep the blood supply. So we go back in and we re-inject it to the areas that you want. Remember, that wasn't this video, sorry, never mind. When we are trying to compress and things like that on incisions, or when we try and avoid compression on incisions, when we make big incisions like arm lifts, we always worry about getting an even compression, because if we compress certain parts, we restrict the blood flow. So any type of compression can slow down the blood flow. So when we re-inject the fat into areas, we want to avoid compression for about the first week to 2 weeks, because we want the blood vessels to be able to reestablish that blood supply into the new fat cells. And if you're sitting on it, or if you're compressing too much or causing too much pressure on those areas, you're slowing down the blood, you know, the blood flow. Just like if you were bleeding and you hold pressure on something to make it stop bleeding, right? That's why you hold pressure, it makes it stop bleeding. So if you're holding pressure on the areas that we injected the fat, you're gonna stop bleeding and the fat's gonna die. Already, we expect only about half of the fat to stay. So we do have to kind of over inject. Once we do that, you know, again, we expect about half of it to stay. If more than that stays and you don't like it, then we go back in and, you know, we can take it back out. But you have to position yourself when you're sitting and when you're sleeping to, you know, not put those pressure on those areas. So one thing, I've got to scoot back. People always ask me about how they're supposed to sit, and I always show them this when they're here. So when you are, when you're sitting, if you notice that when I am sitting up with good posture, I'm not sitting on the top of my buttocks or my hips, which is where we normally do our fat transfers. I'm sitting up. So I could go back to work, yeah, because I'm just gonna sit up with good posture, or holding a pillow or something like that to help me sit up. What I can't do is lean back and put that pressure on the areas that we treated. So either you're sitting up, or when you're sleeping, you're laying on your stomach. If you're a side sleeper, I don't know what to tell you. If you can just get by with, you know, a week to 2 weeks. The BBLs, the fat transfers into the buttocks, if I see, I mean, I feel like from that procedure alone, I see so much stuff that you can buy to support that surgery, from pillows to pool floats to mattresses and chairs and people building stuff. And it's really, I mean, it's a lot. It's this whole like marketing thing on its own. There's so much money to be made in post-BBL recovery products that a lot of it just really isn't that necessary. You just need to, I personally, when I've done surgeries, I don't buy all that stuff. I may buy a nightgown to wear home, and that's about it. But I just kind of wait until I see what my needs are, and then I may order something from Amazon at that time. Amazon comes in like a day. Don't go out and buy hundreds and hundreds of dollars worth of stuff that you think you're going to need, because most of the time you don't end up using any of it. So you know, just try and see how it goes with what you have, determine what your needs are at the time, and then just Amazon it. Then that's my best advice to you. The garments, we do send you home with a garment, or we put you in it when you come in for your follow-up. We have BBL garments that compress, you know, everywhere except some of the areas like the buttock areas where we put the fat in that we don't want as much compression. We have some of those, but sometimes it's just a matter of getting a custom garment to get something to fit, and then you're going to want to wear it as much as possible over about, for the shaping part of it, as far as the, you know, compressing, you could wear it for 3 months until all the swelling is gone. That's a long time though. It's hard to get patients to wear something that long. After that point, it's really, I don't know that it's really helping you at all. But again, I'm here if you have questions. We're always here to go through your procedures with you, but those are just the main things that I could think of as far as liposuction, Smartlipo, and fat transfer. Have a good day.